Hello, I am Dr. Priya Timothy, the glaucoma specialist at Zamindar Microsurgical Eye Center, Kalyan Nagar, Bangalore. I will be speaking now on the various low vision aids which are available at our center. When a person has been diagnosed with low vision and the assessment has been completed, the first thing we do is try to do a regular refraction of the patient. That means we try with the regular glasses to see what is the maximum vision they can get with a normal distance or reading glass. Once we are not able to get an improvement in vision, then we assess the near vision and the distance vision separately. Now, most of the patients who have low vision have difficulty in near. They are not able to read the newspaper, they are not able to look at their mobile, they are not able to chop vegetables, children are not able to read and write a book. So for them we have these different aids. So the different aids that we have for near vision, that is for reading, we have these glasses called the prismatic reading glasses, which have a very high magnification and the patient wears them like a normal glass. So this is the advantage of these reading glasses are that when you put it on, your hands are free to do whatever work you need, whether you have to hold the newspaper or hold a book. The next near vision aid is this called a handheld magnifier. So you can place this on the reading material. Only disadvantage is that you have to go very close to read with this. Another reading aid is this handheld magnifier, which is self-illuminatory. So you have a battery which is placed here and you can put it on and you can hold it in your hand and read the material. The disadvantage of both of these is that the patient should not have any tremors in the hand and they should be able to bend down and read close to the object. The aid that we use for distance vision is called CTV glasses. So these are glasses which the patient wears. Once they put it on, they need to sit on a chair and look at the distance. The disadvantage of these glasses are that you cannot walk around with these glasses, but the advantages are a lot. Wearing these glasses, the patient can watch TV, look at distant objects. When they're sitting in a gathering, they can see people's faces in the distance, and they can even go to the movie hall to watch a movie. This is another aid called a telescope, which a patient can keep in their pocket, and when they want to look at something in the distance, they just have to hold it up to their eye and focus on a distant object and they can see clearly. We have lenses called prismatic lenses, which we can stick on to the glasses of the patient, and this helps them in expanding their field of vision. So this is particularly helpful in a patient with night blindness or advanced glaucoma. We have low vision aids which are non-optical. Means these are things called like a signature guide, where the patient can place this piece of paper on the place where they need to sign and they can feel the edge and sign in the middle. This is useful for people who need to go to the bank or sign a check or sign any document. Then we have a thing called a letter guide. So the patient can place this on whatever they're writing. They can feel along the lines and they can write between the lines. This is another very useful low vision aid, which is the walking stick. So the cane is what patients can use to feel their way around. One must understand that the use of low vision aids is a very slow process and the learning curve seems quite difficult in the beginning. But the patient and their caregiver must take time to understand how to use the aids. They must be positive about it and they must get all the help and support from the people around them. So in conclusion, I would like to stress on the fact that we should not give up when our loved one or our friend has a problem with low vision. We must encourage them and always make them see the light at the end of the tunnel.